Hello, fellow anatomists. We have a lot of material to cover today, so buckle up. First, we're going to talk about the intrinsic muscles of the tongue, which work to change the shape of the tongue. You have the superior longitudinal fibers, which run like this, and they work to shorten and curl the tongue upwards. Then you have the inferior longitudinal fibers, which are deeper. They work to shorten and curl the tongue downwards. Then we have the transverse fibers, which run like this. They work to narrow and elongate the tongue. Then we have the vertical fibers, which run this way, and they work to flatten and broaden the tongue. Alright, moving on to the four extrinsic muscles of the tongue, which originate from bone and attach to the tongue. Their main function is to change the tongue's position. First up we have the genioglossus muscle, which originates at the mandible and makes up the bulk of the tongue. It protrudes and depresses the tongue. The hyoglossus muscle arises from the hyoid bone, and its function is to retract the tongue and depress its sides. The styloglossus originates at the styloid process and inserts into the side of the tongue. It draws the sides of the tongue upwards and backwards, retracting and elevating it. The palatoglossus muscle originates at the palatine aponeurosis, and its function is to elevate the root of the tongue. The intrinsic and extrinsic muscles of the tongue are innervated by cranial nerve 12, except for the palatoglossus muscle, which is innervated by cranial nerve 10, the vagus nerve. The mandibular branch of cranial nerve 5 supplies general sensory innervation to the anterior two-thirds of the tongue. General sensory innervation to the posterior third of the tongue is supplied by cranial nerve 9, the glossopharyngeal nerve. Our sense of taste on the anterior two-thirds of the tongue is provided by the chorda tympani, a branch of cranial nerve 7. Cranial nerve 9 provides our sense of taste on the posterior third of the tongue. Here's a chart of the cranial nerves that supply the tongue, so you can pause and take a look at that. Now let's look at the muscles of the soft palate, which seal off the oral cavity from the nasopharynx when we swallow or breathe through our mouth. First we have the palatoglossus muscle, which we've seen before. It brings the soft palate and the roof of the tongue in contact by depressing the soft palate and elevating the roof of the tongue. This initiates the act of swallowing. The palatopharyngeus and tensor villi palatini muscles tense the soft palate during swallowing, allowing the tongue to press against the soft palate and push food towards the oral pharynx. The levator villi palatini muscle elevates the soft palate to prevent food from passing into the nasal cavity. Finally, the musculus uvulae shortens the uvula and pulls it superiorly. The muscles of the soft palate are innervated by the pharyngeal branch of the vagus nerve, except for the tensor villi palatini, which is innervated by the nerve to the medial pterygoid, which is a branch of the mandibular nerve from cranial nerve 5. Sensory innervation of the soft palate is provided by the lesser palatine nerve, which is a branch of the maxillary nerve from cranial nerve 5.